Hello friends, welcome back to allornonelaw, and this is a Usmle Pearl. And this is Usmle Pearl, and today's topic of discussion is common pathogens in osteomyelitis. Osteomyelitis. So I'm gonna ask you, I'm gonna give you the condition. I'm gonna give you the what you call disease or the what you call it, the past history of the patient, and you have to tell me which of the following, which is the causative organism for his osteomyelitis. Okay. So let's start on this kind of USMLE Pearl. So it's a kind of a revision, and this is really very important for USMLE step 1 and a step 2 CK, and even for a step 3 also. So let's talk. I'm going to give you the condition, okay, and you have to tell me organisms, okay, for osteomyelitis I'm talking about, okay. Let's talk about if they give the history of a black boy from Africa, African black boy, and he has what do you call developed osteomyelitis. Which of the following organisms do you think? Which of the following, or which organism do you think? A black boy, black African male, African. Okay. So, what would be the organism that can cause osteomyelitis in this patient? So yes, it's a salmonella. Remember, even they can give as a black boy or African guy, or they can give as what do you call they're suffering from a sickle cell disease. So okay, sickle cell disease. So remember, this is both mean the same. So try to think of the organism that can cause osteomyelitis in these patients is a salmonella. Okay. So now let's talk about a 65-year-old female patient. Okay, underwent hip replacement. Okay, years back, and now she has developed osteomyelitis. So here the important is a hip replacement. Okay, so what would be the organism that can cause osteomyelitis in this patient? Tell me. Any guess? Okay, let me talk and let me tell you. It's a epidermis. This epidermidis. Okay, epidermidis. Okay, that's really very important. And if they give the young, what do you call a young 22 years old or 18-year-old IV drug user, remember, IV drug user, so what would be the organism that can cause this? The two organisms you should think about, one is Staphylococcus aureus, and the other one is, it can be Pseudomonas. So look for the option in USMLE step 1 or step 2 CK, whether they are given the both the things, and if they are given the both the options, then just think of what you call which is the most common, and think of other and try to search for other clinical conditions in that patient. Okay. Now let's talk about is if it's a 55-year-old and a diabetic, and what would be the organisms? This can be a polymicrobial. Remember, polymicrobial is very important. Polymicrobial. Okay, so the organism that can include is the Pseudomonas, okay, aureus, Staphylococcus aureus, Streptococci, anaerobes. Okay. Now let's talk about if there is what do you call it, most of the people, and they don't have any clinical conditions, and which is the most common organism, most people, common people, common. Okay, it's a common people, which is the S areas. Okay, very important. Now I'm going to talk about is if he has a foot, what do you call a foot puncture wound, if there's any wound in that, and there's foot puncture wound, foot wound, what you can call. So which of the following could be which organism that can cause osteomyelitis? Can think it's a Pseudomonas. Remember, whenever there's a wound, foot wound, and there is osteomyelitis, think of Pseudomonas. Okay, guys. And if they give the history, is a chronic patient has developed a chronic osteomyelitis, and the chronic osteomyelitis, because they give that 6 months back or 1 year back he had this osteomyelitis, and again he has developed the osteomyelitis, and which of the following could be the cause for this osteomyelitis, then if it's a chronic, think of Staphylococcus aureus, Pseudomonas, or Enterobacteriaceae. Okay guys, so these are the organisms that you should remember for your beautiful examination. That's a USMLE examination. Okay guys, so thank you so much for watching this video. I hope this video is really very helpful, and please do share our videos with your friends by sending the links, and please do subscribe. Thank you so much. Take care.